for volunteering for the Iowa Mission of Mercy. My name is Dr. Patty Meredith, and I'm your dental chief. Over the next couple of days, it's my job to ensure that our mission runs smoothly so that we can provide as much dental care as possible to all those folks in need. You, as our dental professionals, are the core of our success at the Mission of Mercy, and we gratefully appreciate your generous donation of time and resources. Our philosophy is to provide the most urgent needs for as many patients as we can. Your patients will come to you from dental triage with 4 of their most urgent needs identified. Although you may find many other needs in your patient's mouth, please try to stick to those identified by dental triage and complete that treatment as the first priority. After you've checked in, you will receive a document that gives you details about the patient flow through our Mission of Mercy. But just to give you a little bit more information, I want to review some of the areas for you. If during the next couple of days you have any questions, just go to a clinic lead. The clinic leads will all be wearing orange-colored vests. They can answer your questions for you. So patients will enter the system and go to medical triage. In medical triage, we determine if the patient is fit for dental treatment. We will do some tests as indicated, blood sugars, blood pressure, and then the patient will proceed from that area. If the patient does need pre-medication, they will receive it in medical triage. The next stop for the patient is dental triage. And in dental triage, your colleagues will be using just a primitive sort of instrumentation, lights, no explorers, and they will be determining the patient's most urgent needs. The patient will then go on to their treatment areas. Now remember that the first patients of the day will not go to numbing. They will be coming directly to your chair for treatment. So the first patients of the day are not numb. So you'll need to administer anesthesia to them chairside. All of our pediatric patients will be going directly to pediatric dentistry. They will not be going through the triage process. When patients leave dental triage, they will be leaving with a card that designates what area they need treatment in. The most important thing here is that we limit the combinations of cards. Patients can only have combinations in oral surgery and the lab, or another treatment area and hygiene. They cannot have combinations between restorative and oral surgery. If they have those needs, the patient care must be prioritized as to which department comes first. Next, I'm excited to share with you these cards. The red card means stop, I'm finished. Basically, you just hold up this card at your chair when you're finished. The patient escort will come and get your patient and their paperwork and take them on to the next spot. Now the green card is even more fun because it means go. Go, I'm ready for a patient. So you just hold up this green card and a patient escort will bring you a patient. You don't need to leave, you just stay right at your area and they will bring the patient to you. The next card hopefully we won't use too much because it's yellow and it means help. It means I have a question, it means my equipment is broken down, it means I need something. And if that's the case, you just hold up your yellow card and someone will come and find out what you need to have done and take care of it. We are providing endodontic care at our Iowa Mission of Mercy, but this care is very limited. And it's important that you know that each patient is screened for the appropriateness of their care to make sure that the tooth is restorable and that it can be a long-term serviceable tooth for the patient. These teeth will receive a final restoration at the Mission of Mercy. The next topic I'd like to cover with you is prescriptions and the pharmacy. So on our treatment form in the very bottom is a corner where all the prescriptions are listed. These are the prescriptions that you can choose from for your patient. It's very important that you understand that these prescriptions are being paid for by the Iowa Mission of Mercy. When the prescription is written and you sign your name and then you put your office phone number on the form, the pharmacy desk will call a pharmacy in the area. The patient will then go pick up the prescription. This is the only method we have for prescription dispensing, and it's important that we don't over-dispense prescriptions. The next area I'd like to talk to you about is the laboratory. At the Mission of Mercy, we do provide replacement of missing teeth for our patients. In the laboratory area, we do just simple replacements called flippers with less than 6 teeth. The most important part to remember about this area is that the patient must have their impression made prior to having their teeth removed. Okay, so now I'd like to talk to you a little bit about completing the form. Again, this form is really important to us at the Mission of Mercy. It's our only record, and we need you to complete it with a blue pen. It's important that you sign your name in each area. You'll notice the medical information is on the top and then the triage information. And every time you give anesthesia, it needs to be entered and the doctor sign the form so that we know where the anesthesia was given. At the bottom is the procedure component. And this is very, very important to us because we keep track of the dentistry that we provide at the Mission of Mercy. So we need you to fill in under each code the number of times you complete that code and then the tooth number. We don't need surfaces, just the code and the tooth number. Accuracy here is very important for our success. As a reminder, when your patients finish treatment, they will exit the Mission of Mercy. If they have additional treatment needs, they may get back in the beginning of the line and come through the mission to have that treatment completed. Now in sterilization, we have a clean side and we have a dirty side. And it's very important that you read those signs and take your instruments to the appropriate side. Sterilization bags will be provided for individual instruments, and you need to put the doctor's name and the unit number on the bag. Instruments contained in a cassette are also available, and you will pick up a clean cassette and return the used instruments to the dirty side. It's very important that we maintain our infection control protocols at the Mission of Mercy. When you arrive in your dental operatory, you'll find this portable equipment. The dental chair can be lowered or raised for the height, but please do not do this alone. That scissor mechanism is very dangerous for fingers and for hands. So if you need to adjust the height of your patient chair or the height of your doctor's stool, just raise your yellow card. Once you have your patient seated in the chair, you can adjust the height of the back. Have the patient continue to sit forward, and you can reach down and squeeze the lever on the back and then lower the back to the desired height. The next piece of equipment we'll talk about is the dental unit. And on this dental unit, you'll find that there are places for your high speed. It's labeled with an H. And your low speed, it's labeled with an L. Then next in the unit is your air water. And in your air water, you'll notice that there's a little yellow ring. To install your air water tip, just pull back on this ring. The last hanger on your unit is for suction, and this area will be just like what you would have in your office. On the top of the unit, you will notice that there are 2 buttons. One is labeled A, and one is labeled W. The A is for the air pressure, and the only important thing here is that you turn it all the way up. The handpiece settings for air are preset. For the water, your adjustment is the knob labeled W. And all you need to do here is just turn the knob to adjust the water to the level that you would like. Now we also have the light, and it's set right now for a right-handed operator. You can change the light and put the tray knob where the light is, and that would be for the left-handed operator. On your light, there are 2 gray rings. The top ring is for the intensity of the light, and you might want to turn the intensity down when you're working with composite materials. The second gray ring is for the aperture of the light, and this will help to focus the light on the patient's oral cavity. Now the last thing we're going to talk about is the toggle switch on the foot control. And the toggle switch is for the water. So if you do not have water, please check your toggle switch to make sure that it's in the on position. The Iowa Mission of Mercy has a medical emergency protocol procedure. If you have a medical emergency in your dental area, remain calm. Notify your lead of the emergency. We have EMT personnel and professionals on site to manage the emergency. If you have an injury or a needle stick, Also, notify your lead. We have a protocol in place to manage this event. Also, do not dismiss your patient. I cannot tell each and every one of you enough how much I appreciate what you have given to the Mission of Mercy. Your gifts of time and resources have made our mission successful. It's clear that the Iowa dental community cares about the people of Iowa. There is no greater gift than to give of yourself. Thank you.